Hi, my name is Eric Schmidt, and I will be presenting my presentation on the current state of healthcare in the United States. There is much debate around how healthcare should be provided in the United States. This great country has been founded and built upon capitalistic ideals and the principle of having a free market that will drive progression and efficiency in ultimately producing goods and services at the lowest cost per unit of output. What we are currently experiencing with the healthcare in this country seems to be the opposite. Although one of the basic economic principles is that prices will rise directly with demand as it rises, healthcare can sometimes be viewed as a right that should be produced at a reasonable cost. Prices for healthcare have been rising for years at the expense of the American people. In my presentation, I will be covering the current state of healthcare in the United States and what exactly is driving these costs up. As we know it, healthcare in the United States is based upon a multi-payer system. First, there is the patient who is obtaining the actual healthcare, who will most likely incur out-of-pocket costs. This will mostly come in the form of copays and deductibles. If the patient does not have health insurance, they will be held responsible for all of the medical costs that they are given, and at top dollar too. Most insurance companies will not pay out the full asking price to the billing medical practitioners, but if an uninsured citizen is treated, they have no representation or backing. This shows the lack of a standard cost initiative in the industry because companies are able to charge freely as they see fit, often at the expense of the American citizen. Then there are the insurance companies who often cover part or most of healthcare costs by citizens because they pay a monthly fee or their employer offers a health insurance plan at which they will incur monthly charges which are deducted from their paycheck. Government programs such as Medicare and Medicaid are offered too for qualifying citizens. Medicare is offered to citizens over the age of 65 to assist with medical costs. They are more prone to health complications, which means the amount of money paid out from Medicare will be substantial. Medicaid assists lower income families with health expenditures. The health practitioners and insurance companies are both profit-driven entities. Medical equipment, especially in hospitals, is also a profit-driven industry, and it does not matter how many lives certain equipment can possibly save. It only matters that they sell this equipment for as much money as they can. As I said previously, there is no regulation or standard when it comes to prices for healthcare. So what is stopping a healthcare professional from charging an inflated price for treating a patient? Oftentimes they are billing insurance companies and do not feel bad about charging such a premium price. However, this will indirectly drive the cost that the citizens are required to pay the insurance companies for health care since they will have to pay out more money. The insurance company will naturally charge as much as they can to increase their profit margins. Then there are prescription costs and pharmaceutical companies. Most top executives of these companies have a bold salary, and oftentimes the prescription drugs that they produce are overpriced. The Affordable Care Act was introduced by President Barack Obama in 2008, which is a reform act that was passed in order to extend health care to more U.S. citizens. It does this by allowing states to expand their medical program, and it also created tax subsidies, also known as premium tax credits. These benefit Americans that are under the poverty level. This has allowed for many Americans to purchase health care plans that otherwise would not have been able to. My little cartoon here further illustrates and pokes fun at the rising cost of health care. U.S. healthcare costs are increasing. Here I have two figures that are representing the rise in healthcare costs as a percentage of our GDP. As you can see, our total Healthcare costs in America were a mere 5% of our nation's GDP in 1961. Through a constant rise in costs, our national health expenditures now equate to nearly 20% of our nation's GDP. The figure on the right breaks down this percentage even further into the private and public sectors. The public sector used to only account for less than a third of the total healthcare spending. But since 2010, it is now accounting for more than half of all healthcare expenditures. This shows that even with a growing percentage of public programs and funding from our government, the cost of healthcare is still a heavy burden to bear for our society. What is creating the significant rise in healthcare costs? These are some of the main contributing factors. The increased cost to receive medical attention. Between the co-pays, insurance premiums, prescription costs, and specialty practice expenses, costs are increasing all across the board. These doctors and hospitals are taking part in for-profit business, and the demand for their service is increasing every day. Of course, they are going to begin to raise their rates, just because they can. The aging population is also helping to fuel this demand. Older people generally will need more medical attention more frequently, and more intensive attention at that. The next point may be all too often overlooked: the overall inefficiency of this healthcare system. Having healthy citizens should be a priority to a country and outweigh extreme margins of profit. Increasing price, quality, and transparency would dramatically increase the consumer-based pressure felt on pharmaceutical companies and healthcare providers. Emergency department costs are high as well. The cost of ambulance and medevac trips have increased substantially, and a big factor to this is the amount of unnecessary calls as depicted in the little cartoon on the right. Chronic illnesses have also gone up in volume, and this may partly be related to the fact that we have an aging population. Finally, we have the administrative costs. This is what I believe to be one of the largest factors to the rising price in healthcare. With all these independent healthcare facilities and insurance companies operating, there is an enormous amount of administrative work that needs to be done, and most of which is overlapping. Health records, billing information, financial summaries, and all other recorded information is being created and stored by numerous companies. The amount of paperwork that goes into proper billing for a medical procedure in a multi-payer health system is just inefficient. It is truly a poor allocation of resources that could be more streamlined. The back and forth billing that is required to dispute claims and eventually get paid is a tired process that is not using our labor in the most efficient way. Here are two figures that further depict the rising prices and ages of our society. The figure on the left here shows now the change in consumer pricing for healthcare has risen at a faster rate than all other items have, which have risen at a rate of 2.2. On the other hand, healthcare expenditures have risen at a rate of 3.5% year over year. The figure on the right shows our aging population is increasing. The chart estimates that by the year 2030, 21% of our population will be 65 or older. Administrative costs. I found this chart on the left to be particularly interesting. The United States spends an average of double what most other high-income countries spend on administrative costs as a percentage of healthcare expenditures. Either other countries must be much faster at doing paperwork than we are, or our system needs to change. This is a direct result of all the different hands that we have playing a role in our nation's healthcare. The figure on the right shows estimated administrative costs for the 2019 calendar year. It is projected that we will spend nearly $500 billion with health care providers leading the way. Is there a better way to provide health care? This is such a loaded question, and I believe no matter how it is decided, people need to accept the fact that there is no free lunch. Whether our tax rate is increased by the government for a single-payer healthcare system, or we have to pay out of pocket for healthcare, costs need to be present in order to provide care. The first thing that we can do is attempt to make the process more efficient. I've provided 2 alternative systems that are in place in other countries. The first country is Singapore. They nurture a healthy nation by promoting good health. They promote personal responsibility and avoid over-reliance on welfare or medical insurance. They provide good and affordable basic medical services to all. They rely on competition and market forces to improve service and raise efficiency. They will intervene directly in healthcare when necessary, where the market fails to keep healthcare costs down. Government controls exposure and use to any and all medical technologies that are used. This greater overall government control includes the acceptance and use of any new vaccines, medicines, or procedures. The country still is private